walked into Cherry Hill Dental just a few minutes ago for the first time, and you talk about impressive. I mean, let's say I came in to have some work done. Dr. Tony Gadbois is going to answer the questions here today. What can I expect?
Well, the first thing you should expect is that everything's explained to you. We really pride ourselves in being able to educate the patient well. And our motto is, you can do well what you can see well. So we start with digital radiography, because it seems to make more sense. Instead of looking at a tiny little x-ray on a light box, you're actually viewing your x-ray on a large screen in a format where we can colorize things, we can blow it up, we can magnify and really show you, so you can kind of participate in your diagnosis and the treatment plan that you choose.
People feel more comfortable when they know what's going on, basically.
I think that the day of being able to just walk in and just kind of, let go and whatever the doctor says is in the past. And, with computers as a tool, we can really make it an interactive experience. You kind of get a nod, you can see in their eye that it makes sense to them, and they're not accepting a treatment that you've just pitched at them. They really understand and are accepting of what you have planned.
Now, I know you guys are cutting edge technology here. I mean, as far as, again, coming back to the patient, what does all this mean? Tell me about some of the technology you have and what it means to somebody like me.
Well, one of the first things that we do is, in that initial exam, after we've gathered a lot of the information that we have that would be traditional, we couple that with more modern technologies, like using a laser to identify cavities on your teeth before they can be seen on the x-ray or even with the naked eye. So bringing technology like that to bear allows us to treat earlier. It allows you to keep more teeth and more of the tooth structure, and it allows your treatment to actually be more conservative and ultimately less expensive.
You mentioned a medical student, for example, came in having some problems. Because of your technology, a lot of those problems were solved.
There was a young lady that came in, and she had been having some problems, and she had been tested for autoimmune problems, and she'd seen several specialists, and no one could really figure out what the problem was until finally she came to see us. We were able to do a cone beam CT scan on her, which was able to detail her anatomy in 3 dimensions on the computer. So I was easily able to dissect the problem and diagnose her with the need for a root canal. And although we couldn't see her need on a traditional 2-dimensional x-ray, we were able to see the exact problem right there on the computer screen, and it allowed us to go straight away, provide the root canal treatment on that tooth, and alleviate all of her problems to where she was able to, return to school, etc. So it never ceases to provide invaluable information that we need when we're treating a patient.
Again, seeing better, and it speed things up as well. I mean, you have other technology where...
Well, one of the technologies that we have that I use on a daily basis is called CEREC. And the CEREC technology allows me to take a camera and scan the prepared tooth, transmit that data to the computer, where I can sit chairside with the patient, design the restoration completely, send that information 2 rooms away to a machine that mills the restoration, and in about an hour I can provide the same exact restoration that might take a lab 2.5 to 3 weeks to provide via the mail.
That's amazing.
So it really puts me in a lot more control when it comes to a patient's treatment. And it's obviously much more convenient for the patient, because instead of 2 visits and wearing a temporary and some of the things that can go wrong with wearing a temporary, we've had them in and out in about an hour with the restoration.
Appreciate your time. I mean, time is golden around here, and it's an impressive office here.
Thank you.
Just amazing.
Thank you.
Tony, thank you.